Assalomu alaykum hammaga. Do'stlar, indiyskiy kino boshlandi deydi-ku. Nasim akam o'rni bilinyapti. Albatta Nasim akam shu olib borayotgan videolarni biz ya'ni ikkita shogirdlari shu yerdamiz.
Shunaqa jigarlar. Nasim aka ketdi. Shogirdlari bundan keyin kinolarni sizga ko'rsatadi. Xudo xolasa, zo'r tomondan zo'r narsalarni, chiroyli joylarni, hamma narsani ko'rasiz. Shogirdlardan kanalini ko'rasiz.
Xullas do'stlar, Bахтиер Индия уже esda qoldi. Bахтиер Индия deb kanalga kiramizda Hindistondagi bo'layotgan jarayonlarni, ya'ni har xil kasallar keladi. Hozir aynan menda shu bitta o'zgarish bor deb mana videolarda takror aytdim. Hindistonga kelib bitta o'zgarishni topdim. Ya'ni 2 yil davomida qiynalib, azob chekib o'tira olmay, yota olmay degan holatim ketdi. Opshi yo'qolib ketsin. Xullas Bахтиер akani menga foydasi tegdi. Mana shu tomondan yaxshi vrachga olib keldi.
Gap yo'q. Bugun yana videolarning davomida bitta videoni sizga yana qo'yib beramiz. Doktor Atul Metal aytgan bitta doktorimiz bor. Bu ENT departamentidan quloqdagi, burundagi, bo'g'oqdagi doktori bu. Вообще zo'r doktor, professor doktor O'zbekistonda, butun O'zbekiston taniydi u doktorda.
O'zbekistonga borgan, ha?
O'zbekistonda borgan. Bugun yangi texnologiyaga nima apparatlar, nima ishlarni qiladi, qanaqa operatsiyalarni qiladi. Shunga video bugun hammani taklif qilgan edi. Bizdan taklif qilgan edi.
Konferensiya bo'ldi,
yig'ilish bo'ldi. Ketib gaplashdik, o'zi ma'lumotlarni berdi. Xudo xolasa videoni davomida shu ma'lumotlarni ham sizga qo'yib beramiz. Kim ingliz tilida biladi, bilib olsin nima narsa aytgan doktorlar. Ko'rasiz videoga. Shu masalasida kim murojaat qiladi, shu вообще zo'r doktor bu.
Do'stlar, o'zimizda eskitdan qolgan gap bor. Cho'pga ixlos qilsang, cho'pdan foyda topasan deyshadi. Men aytganim, qanday yaxshi chiqyapti, ko'karib qolyapti menimcha. Mana. Xullas, men aytmoqchi bo'lgan gapim, kimdir Hindistondan, kimdir O'zbekistondan, kimdir Tojikistondan, qayerdan bo'lsa ham shu kasallarga Alloh shifo bersin, g'oyibdan shifo bersin. Shu uxlayotgan vaqtiga shunday ko'zini ochsin, dard bo'lmasin.
Inshaalloh.
Endi sog'lom insonlar hech qachon dard ko'rmaylar. Men shuni Allohdan so'rab qolaman. Bu necha kun yashaymiz, necha yil yashaymiz, Allohning bergan har bir ne'mati. Shu baxtli yashab o'taylik, xursandchilikda, yaxshilik kunlarda. Eng zo'ri mehrga yetmas ekan. Men shu mehr borligini bilar ekanman deb yurgan ekanman, lekin o'zi aslida bilmas ekanman. Ana shu bemor bo'lib yurganmani o'zimni bemor ham hisoblamas ekanman. Men yaqinda mazam bo'lmay shu holatga tushib, qanday bir azobli kunlarni ko'rdim. Hammasi ortda qolgan bo'lsin. Nasib bo'lsa, shu o'tkinchi dunyo necha kun umr bo'lsa, shu bizdan yaxshilik qolsin deb men harakat qilaman. YouTube kanalini ham kimgadir foydam tegsin degan maqsadda olib chiqganman. Har videoda har xil gaplar bo'ladi. O'sha natijalarni ham har bittasini aytib boraman. Shuning uchun esda qoladi. Bахтиер Индия deysizlar, kanallari chiqadi. Kanallarida ham mana biz tushuntiryapmiz. Aynan baynisa emas, davolanish emas, boshqa videolarni ham. Ya'ni kulgiga olaylik, Shohirxon rolini o'ynab beradi sizga. Shunaqa. Chunki buni faqat kasallar emas, chunki videoni ko'ramizda, videoda faqat mazza qilamiz.
Inshaalloh.
Past history of fundamental nasal surgery having hole in the nose, in the bone, and they will be having so much discomfort because of that. They'll not be having that feeling of they are breathing inside and out. All those things we are dealing. And we also do all the benign and cancerous lesions of nose and sinuses. So this is our operation theatre setup. We have a very good endoscope and very good view. You can see the magnification. So we can do our surgery such precisely and nicely and get a very good surgical outcome. So coming to the throat and voice related disorders, We deal with all the vocal cord, voice related problems like cyst, nodule, polyps, masses, and all the vocal cord related cancers. Everything we deal with surgery, and also patients who comes with voice change. So we have daycare endoscopies to identify what is the disease. We can diagnose it properly, and we also give treatment accordingly. And we can also take biopsies from the voice cords to diagnose, to confirm whether the patient is having any cancer or not. We also deal with all the mouth related, oral cavity and throat related diseases like tonsils, tonsillitis, peritonsillar abscess, and all the, nowadays very important is this obstructive sleep apnea thing. All the patients, now it has become like a lifestyle disease. The patients who are having chronic snoring, obesity, we have such a good amount of patients who are coming with this. We have a ample number of surgeries dealing with this obstructive sleep apnea. So beginning from the nose, we do nasal surgeries for this nasal obstruction. We do septal corrections for the block inside the nose, and we have palatal surgeries for dealing with this OSA. And whenever there is this uvula, there is a small tongue inside the mouth, you might have seen. So we do surgeries for reducing that. And in obese patients who are very overweight, the bulk of the tongue will be too much. Because of that, they can have snoring. So we do tongue-based reductions also. We do palate surgeries. Okay. So this I have already explained. We do everything related to. So these are the procedures which can be done on OPD basis. We have endoscopy. We have a bronchoscopy suite where we do all the fiber optic laryngoscopy, video laryngoscopy, and we can do a swallowing assessment also. And coming to pediatric otorhinolaryngology, we deal with children who are having adenoids. Adenoids are tonsils, tissues behind the nose, like tonsils in the mouth. Okay, so many patients, many children have problem with this chronic infection, breathing, snoring, their sleep will be disturbed, and finally they'll end up having this obstructive sleep apnea kind of. They'll not be able to breathe properly during night. So we have solution for all these things. Okay. So we also deal with children who have congenital deafness issues. We do cochlear implantations, and children who are having external ear deformities like preauricular sinus, cyst, and the children, whenever they are having this adenoid enlargement, there is a tube connecting between the ear and the throat. Okay, so because of the negative pressure, there will be fluid collection inside the middle ear. So we do surgeries to remove that also, and we'll put a small tube called grommet so that the aeration of the middle ear will be fulfilled with that. And we also do surgeries for thyroglossal fistula, cyst, everything. So this is the coblator, which is a newest technique which is available with us, and basically it helps us to do a bloodless, scarless surgery, and we have got very good results with this because the patients can get admitted and do the procedure in daycare, and there will not be any pain. Children will be very comfortable and smiling, eating after the surgery.
Doctor, and this is done on general anesthesia?
Yeah, basically all the head and neck related things can be done under general anesthesia. Only in adults, when we can do the nasal surgeries, we do under local anesthesia. All the other surgeries we do under general anesthesia. Only limited surgeries we do under local anesthesia. Okay, and especially for kids, we prefer general anesthesia.
And this is for how long? The procedure?
Half an hour.
Half an hour procedure. So this is the adenoid tissue which I have explained.
Can
Which
do
is,
same day. Oh.
so this is the coblator wand, which helps to vaporize the tissue. Okay. So this is this has got very good, better results than the conventional other methods. There will be too much pain. Children will not be able to eat properly. All those things. So obstructive sleep apnea, as I've already explained, we can diagnose this. We do drug-induced sleep endoscopy. We'll give the patient a medicine to sleep, and then we'll do the endoscopy and see in which all points patient is having obstruction. Okay, and then we'll plan for the surgery. And we also have sleep study to analyze how much oxygen is reduced during sleep of the patient. Everything I've explained already. We also deal with endocrine gland disorders like thyroid related diseases, parathyroid related diseases, and pituitary gland related diseases. And we also deal with cancer of the thyroid gland and parathyroid gland. We are also associated with the salivary glands, parotid and submandibular gland. We deal with the stone, any infection of the gland or any cancer of the gland. We treat all of those. We also take care of the neck masses. Whenever patient comes with a lump or mass in the neck, we evaluate and we properly diagnose, and then we'll manage depending upon the case. So there are so many things in the neck like lymph nodes. Whenever patient is coming with a lymph node swelling or Ludwig's angina, which is an
On-course surgeries we are taking all.
we are doing all the head and neck related this neck related cancers. We do surgeries for that. We do neck dissections. We do biopsies from the lymph node. We do complete thyroid removal. We do partial thyroid removal, and we also do parathyroid, which is a small gland which is situated behind the thyroid. We remove that also. Sometimes tumor can happen in that only, so we selectively remove that also.
So my question is, Dr. Ann, how does a patient make a choice if the patient has been diagnosed with, say,
Surgeries, cancer surgeries we used to do, and it was there in our syllabus from very beginning, and we've been doing from our PG days. So this on-course surgery has been redefined and it has been delineated now. But like I've been doing laryngectomy since 1992. It's part of my curriculum. But now they have a delineation. This on-course surgeries or.
So, Dr. Ratul, my question was that you do the same
thing which they do.
Okay.
In fact, we do more conservative approaches. We do more. Our approaches will be more to protect the tissues, the physiology and functionality of the head and neck. That is very important.
Because see, I think most of us are not aware. We think that, oh, if it's cancer, then probably the department changes.
So laryngectomy, thyroidectomies, maxillectomies, this are actually used to be part of ENT only. Now there is a bifurcation. Now after 10 years down the line, you will have only ear surgeons, only rhino surgeons. They are they have come out of our shoes. So
Correct.
I think that's good enough. Any questions?
Any advancement, anything that you do, which is like an advancement in technology or
See, we are here at the state-of-art hospital. We have all the I established this department way back in 2012. And when I joined this place, I came from Max Hospital. And I had all the latest equipment we have are present in my department. From audiology to the OR, the surgical instruments, we have no Indian instruments we use. We have all stores instruments. So, there's a difference in the pricing definitely.
नहीं we are kidding यार, we are having a good time here.
कुछ queries है, कुछ questions है जो हम लोगों के पास queries आती हैं, तो सर easily solve कर देंगे. अगर right now अभी भी आपके पास कोई queries है तो वो भी
आजाओ.
And we've been doing for last 5.5 years. And Dr. Shilpi is with us for last 5 years. She's an associate. Dr. Parul Again, she's very good for last 5 years. And is a junior most, but very hard-working girl. She just joined about 6 months back, and she continues. And we are available 24/7. Our OPD starts at 8 o'clock. We finish by 6. But one of us is always on the duty. We are there for you. Any emergency, we are there. Thank you, sir. Thank you.
Thank you so much.